Welcome to Pop Politics and Culture. We have Diamond Studded, and all the way from California, we have celebrity concert photographer Felicia in the building. Like, she gets the money shot. So if you follow her Instagram, you see it right there, right underneath her profile picture. She always gets the money shot. Like, I was just on her Instagram and I saw these amazing shots of Lil Uzi Vert, like all like dripped out in the red. Like, what's the experience like being that up close and personal and like getting the money shot? Like, and this is a job and you're getting paid to like have fun with it.
Yeah, I can't even describe the feeling. I love it. I'm always in like as if I used to be an athlete, so I feel like I'm always in game mode. I'm not dancing, I'm not like socializing. I'm just like I got to make sure I get that shot.
How long have you been doing photography? Like when did this become your passion?
I would say starting college is when it became a passion of mine, and then seriously taking it on towards the end of my college career. I started like really taking it more seriously and like starting to charge people for shoots.
So what was your major? Were you into visuals in college, or did you do something else and this just kind of was something that was more interesting to you?
Yeah, so I actually studied sociology, and then I got a double minor in ethnic studies with the concentration in African American studies and gender and sexuality studies. So had nothing to do with photography at all. I took one photography class, and my professor was like, "You should change your major to photography. Like, I see something in you. Like, I normally don't tell my students to change their major." And I was like, "Nah, I'm not about to do this full time." And well, he was right because I'm doing this.
Man, like that's accolades on top of accolades. The fact that you have multiple college degrees and then you segued into photography, and that's something huge and major because us being minorities and members of the LGBT community, it's not really heard of people that have educational success. Like usually they just get out there and they find their own way. Most people get popular, but they have a total lack of education. But like it's great to hear that like you have all of those accolades underneath your belt and you're well versed too, so that lets us know that like this is great because I love people that can have a conversation. Like I get some people on this show that can't speak in full sentences so the footage never actually gets aired. Like I have a hard drive full of interviews that will probably never get posted because I'm like, what am I supposed to do with this? These people can't have no conversational skills. But I heard you say that one of the things you went to college for was gender studies. So, when you were going to school for gender studies, can you give us a little bit of informational background about the educational aspect of that?
Yeah, it was definitely, you know, professors just doing the courses to make you, pass the class type thing. I feel like I definitely learned a lot, but there's been times where we would go over like definitions of something, and I'm like, wait a minute, like without education, I know that that's not actually what that means. And so I feel like there's a disconnect between the actual educational system, even when it is trying to be educational when it comes to like controversial topics, it's still not accurate. And I feel like that was tough. I'm glad that I majored in it because I wouldn't be able to pass on the knowledge that I have now if it wasn't for these classes.
Totally. I was going to school, abnormal psychology and human growth and development. A lot of the definitions didn't really make sense to me either, and I'm like, this does not seem like what you're saying it is. But for the sake of the answer being right and me being able to pass my studies, like you said, like a lot of times in those type of classes, they I do feel like they just pass people along because a lot of people don't have the passion for psychology and for the human brain and actually getting to know people. One of the reasons that we reach out to you is you had a very interesting post on your Instagram, and I believe it's like one of your pinned posts about a huge step that you're making in life. So can you tell us about that huge step and what got you there?
Yeah, so I decided last year, the end of last year, that I was gonna go ahead and get top surgery, which for those who don't know what that is basically removing your breast. Simply put, the reason why I decided to take that step was even at like a young age, I never had um, like attachments to my chest. If anything, my chest made me feel uncomfortable. I was binding, which is a whole nother issue with physical health. Um, and just not being able to feel comfortable out in social settings or in a relationship. So I decided that now that it became something normalized, I decided that I was going to take that step for myself, start feeling free in my own body.
And that's a huge step because a lot of women have times in their life where they do feel uncomfortable in their body. Like one of my best friends, she just went and got her boobs done, like, and they look totally fucking amazing. But throughout her whole life, her situation was she felt uncomfortable in her body because her chest was too small, and she didn't feel that she was really the woman who she was designed and created to be, because she felt like, she was built like a prepubescent teenage girl. So she'd
Mm.
always like use those words to describe herself. Like, I feel like I'm pre-puberty teen. Like, I don't have no titties, but I got all of this ass. So she went to have the surgery done. And what's interesting is that she didn't have to go to any therapy. She didn't have to see anybody. She didn't have to have any treatment. She was just able to go, and they gave her this all these different boobs to fill, like made out of different materials, and they gave her a list of sizes, and they're like, hey, pick one, and when do you want to come in, and it's going to cost X amount of dollars to get the surgery done. And then we have programs for post surgery where they like put her in like this plush hotel, and they had people like literally massaging her boobs and cleaning them and stuff like that. So like she did the whole nine. But it's interesting that, when women are uncomfortable in their body and they want to remove things, you guys have to go through so much medically. So can you tell us about the type of obstacles that you've experienced in just trying to have a medical procedure done?
Yeah, can I curse on this?
Yeah, you could curse.
Pain in the fucking ass. I'll tell you that. Just the insurance alone. I'm trying to get it covered by insurance. I think it might be easier if I was like, oh, I have 8 racks, bet I'm gonna go to the doctor and say this is what I need. I think it would be less of a hassle, but I don't got it like that, not right now. So I'm trying to get it covered through insurance, but also because in the insurance world, they don't know, like they're clueless. So I wanted to do this through insurance as well to help bridge that gap for people to be able to continue to go through insurance, because a lot of people just give up. Because I've done a lot of research on this, and people were like, yeah, I tried to go through insurance, but it was too much of a hassle, so I just ended up paying out of pocket. And I don't want to be that person. I'm not saying that there's anything wrong with that, but I want to be able to help other people who may want to do this and be like, okay, this is what I had to go through. So here's steps that you can take so you don't have to deal with 1, 2, and 3. Um, but just like getting a whole bunch of numbers, they don't know what they're talking about. Um, Having to get referrals, and then my doctor says, "Oh, we don't do that kind of referral." And it's just a mess. But yeah, it's being worked out.
From a little bit of research that I've had the opportunity to do since the last time we talked, and some of the things that you touched upon, I found it a highly egregious practice that because you're not feeling comfortable in your body, that the system is trying to put a label on you as like a trans and telling you that you fall into the category of a transgender human. And from our conversations, we understand that you are a woman, you identify as a woman, and you love who you are. It's just certain things about your body that you don't like. And when I look at it, it's no difference than, me feeling like, my ass ain't big enough, so I might want to get a BBL, right? So, that's body dysmorphia. And I feel like a lot of times when it comes to LGB people, they confuse our body dysmorphia with gender dysphoria, because the amount of money that it costs when you are a gender dysphoric individual, from the hormone therapy, like, and the amount of pills you take a day. Like, I watched I Am Jazz, and I watched Jazz's whole transition, and I could not stomach the amount of pills that they had Jazz on, like from the morning to night. I'm like, bro, you taking like 20 some odd pills per day because you have to keep your hormones at a certain level. And once they went through their bottom surgery, they had to do it like 3 separate times. And I'm like, you
Mm.
know I understand that that's gender dysphoria, because Jazz felt like I was born in the wrong body and I should have been a girl. But, in communicating with you, we understand that you don't think that you're a man and that you don't feel like you should be a boy. So why does the medical professionals not have an outlet for women who don't feel comfortable with their body? Because there's so many women who don't feel comfortable with their tops. Like, my cousin just had a breast reduction. and her insurance covered it because they called it a breast reduction actually.
Right.
So I'm like, so is it the label of the surgery you want as to why they're trying to charge you? Because I don't see logically why, because I see how this could help you medically too, because being top heavy messes up your back, and it causes a
Exactly.
lot of other physical problems. So as far as like health issues, like actual health issues, why aren't they trying to see the other risk factors in your health that this may be attributed to make sure that you have quality health, because it's not about you trying to change genders. It's about you trying to for what I'm gathering, is put the quality of your life first.
Exactly. You said that. You said that great. And I think too, like gender dysphoria isn't necessarily just a trans issue. It's a human issue. Like you could be cisgender and have gender dysphoria as well. And for me, like me personally, as a masculine presenting woman, and this is just me, because of how big my chest is, I feel more feminine, which takes away from my gender expression, which is um, masculine presenting, right? So for me, that's that's like the internal aspect of it. And then, like you said, the physical aspect of it, definitely back problems. I've had to go to the dermatologist just because of like the binding. It causes rashes. Um, so the surgery itself is considered trans, but I've told my surgeon like I'm not trans. I consider myself cisgender. I was born female. I still identify as a female, but being masculine presenting, I want my body to match my physical expression, right? So that's that was another battle. But you still have to go through like the referrals and the letters of rec and all that stuff, just because it's still considered a transgender surgery, which is
But the label of it being a transgender surgery logically doesn't make sense to me, because Angelina Jolie had the same fucking surgery. Like,
right.
so there's other women, and we can pick famous women, we can pick non-famous women, we can go through social media and pull a plethora of different women who have been uncomfortable with their breasts and their breast sizes, and their doctors have actually performed these surgeries um under the guise of breast reduction. Like I told you, like my
Mhm.
cousin, just like she was in like a damn near triple D. Like she was stacked, but she was like smaller frame like me, but she's super stacked. So she was able to get a breast reduction. Her insurance paid for her breast reduction. So it's alarming to me that they're unwilling to give you that same type of access.
Yeah,
Because
technically it's considered a double mastectomy, right? I'm just getting rid of both breasts. But because of how I identify, or so they want to say, now they want to take the gender dysphoria and the gender identity and sexual
your
orientation.
sexual orientation should not have anything to do with your medical treatment. So by
Exactly. Exactly.
identifying as a lesbian woman, they should not try to automatically put a T over your head because, like, oh, it's a lesbian that wants to have a surgery that we're pushing towards the trans community. That's a huge disconnect with big medicine. And all you doctors, if y'all watching this, you guys are fucked up for trying to force hormones and cross sex surgery on people who clearly identify as biological females and biological men. They just have uncomfortabilities and insecurities in their bodies. You guys should never try to force a woman to take hormones, because if she did take hormones, she would be growing a beard, her voice would get deeper, and there's certain things that honestly, once you start taking hormones, your body doesn't recover from those things. It doesn't go back. Like I've done studies to say that, like when women are taking hormones, they have increased risk of endometriosis, cervical cancer, and a plethora of other diseases. So I'm like, so you want me to pay you to put my health at even more risk? Like,
Right.
and, and if I can't afford to continue the treatment and continue to take these pills, my health is going to have a huge decline. When there are women out here who don't feel comfortable in their bodies, and they're able to get these breast reductions and these mastectomies because they identify as heterosexual women. And I don't feel like you should have to go to the doctor and identify as a heterosexual woman in order for your insurance to pay for your benefits either. Like, it's egregious all across the board. Like, I definitely don't agree with it. I feel like you should have the same type of health care that any woman has when she goes to the doctor and says, hey, I'm having issues with my back. I'm going to the dermatologist because I'm getting these rashes and stuff from binding. Like, at this point, it's a physical health issue,
Hmm.
and it's like they're trying to treat it more so like, I feel like they're trying to say that people are mentally ill because the more people that they diagnose with gender dysphoria, the bigger the bank gets, right? The
Hmm.
more advocates that you have for it, the more allies. And, I'm not transphobic. I have trans friends, but I also don't feel like everybody who wants to change their body is classified as trans. And that's what I love about you, the fact that you're not allowing the world to tell you what you are and put you in a category because of what they feel you are, because of the choices that you want to make. And I'm glad that you were able to find a surgeon that's willing to go forward with the process and give you what's going to put you in your happy space physically, mentally, and emotionally without um, putting you in a position to have to take all of these hormones and, ultimately causing a decline on your health and destroy your body.
Yeah, yeah, and I think that's why I'm going towards the medical insurance route, because I'm trying to get them to understand this isn't just a trans thing. And when I've talked on the phone with people, they're like, "Oh, well, you have to go to the transgender department." And so when I get over to that department, I'm like, "You should probably change the name of this department because it's not just transgender people who are looking to get this surgery." Even my surgeon, like I told him, like I'm not trans, and that was fine, you know. But if you go onto the website, underneath the category of different procedures that you get, it's under transgender for top surgery. So I want to talk to him about that too, and be like, you should change this, you know, so that more
Yeah,
people.
totally.
And at the end of the day, you're going to get more clients trusting you because you're not putting them into a box. And so I'm trying, as much as it's a pain in the ass to deal with this insurance situation, I'm hoping that when I'm talking to these people, they're like, "Oh yeah, let's fix this on the website so that more people can feel welcome when it comes to this issue."
And also, I feel like they probably make more money if they were actually treating people's medical issues, because you've touched upon the different medical ailments that this is causing you in your overall quality of life. And when we talk about quality of life and medical issues, if I was like hypertensive, for example, I would be on blood pressure medication. My insurance would put me on those blood pressure medications. If I had a hernia, they would go and cut that motherfucker out. So when you have medical issues, they do give you medicines to treat those issues. And if it requires surgery to aid in the healing, they do provide that. Like, your insurance should not neglect providing you medical care because they want to increase transgender treatment and try to force pills on people. Like, I'm totally against them trying to, say, oh, okay, well, you don't feel comfortable in your body, you look like a woman, but since you want to have top surgery, you must want to be a man.
Yeah,
Like, never did you once put on that piece of paper when they asked you to, what do you identify as? You didn't put he or him. You didn't put male. Like, you came in there and you let them know this is what it is. This is what's going on with me. And you have a medical background and a medical history. So if they wanted to pull your records, they could see how many times that you've been treated for certain things. So
hmm,
I think when you are petitioning insurance companies, one thing that you want to do is advocate for your medical record and your medical history and your history of being treated for back problems and going to the dermatologist for other things, because I think that may, allow them to see that for you, it's more than just a cosmetic surgery.
hmm,
I think that they decline certain things because it appears more cosmetic, because they're saying like, oh, this person is getting the surgery because they want to look a certain way. Because we know that you can't go get insurance will only pay for you to get your boobs done if you had breast cancer and they had to give you a mastectomy. So if
hmm,
you were a breast cancer survivor and you went through the double mastectomy process to remove your breast cancer, they do pay for breast implants in those situations, right? Which
hmm.
is also cosmetic surgery, because medically you had to have your breast removed. So cosmetically you don't feel comfortable. So if the insurance is paying for them to get their breast implants, I logically, it doesn't make sense to me as to why they won't help a person who is having clearly medical problems and it's affecting your living.
Yeah.
and being able to move around and stand up. Like when you have all that weight on you, like I could only imagine what you go through because you're way more top heavy than me and you're taller than me, so you have more body mass than me. So it's like if I was in like a D cup, I'll probably be over here like walking like the Hunchback of Notre Dame. Like I couldn't imagine myself having that much boobs and dealing with the actual medical issues that would come with that. Like I would want to go get a breast reduction. Truthfully, like with my small frame, if I had some super big titties, I would be like, yeah, you need to go make these smaller. Like I don't think I would go as far as taking them all the way off because like girls like boobs and they like feeling on them and stuff. So like when you with a bitch and shit, that's the purpose of her saying she's a lesbian because she wants to experience a woman's body. So in my mind, I'm not gonna go and make myself look like a man because then she could go find her a nigga that got a six pack and she could touch them ridges. And the way my stomach's set up, I don't have that. I don't have them abs going on. You feel me? But I could see myself having a breast reduction. I've went
Yeah.
through periods in my life where I didn't feel comfortable with my body either. I'm like, well, I got these titties, and then I want to try to look all skinny and smaller because I think the growing up in the LGBT community, I was programmed to think that you had to look a certain way to be a stud,
Hmm.
right? And in my mind, I felt like my grandma used to call them bull daggers, right? And I'm like, what the fuck is that? And I found out that's like the most disrespectful term that you could call the gay people. So my grandma would be like, y'all bull daggers and stuff like this. And then you would see the older studs and stuff, and they be out here looking like straight niggas. You know what I'm saying? They want to put on their suits and shit, and they carry themselves like as a dude. And I'm like, well, I don't see myself as a feminine, like a super feminine woman where I want to wear dresses and carry purses and get my fucking nails done and shit on the regular. But I also don't see myself as like a super nigga where I'm like, hey, yo, what's up?
Yeah.
See myself as like one of the ones in the middle where I know I'm a
Yeah.
girl, I identify as a girl, but I feel comfortable wearing the t-shirts and the jeans and the track pants and the Jordans, and that's me, that's comfortable, right? So
Yeah.
my clothing and the clothes that I feel comfortable in has put me in a box in a category that they call a stud. I
Mm-hmm.
personally don't even know if I would identify myself as a stud because most of the stuff that studs do, I don't participate in those behaviors, right? Like they like, oh, do you fuck these girls with straps? No, because I don't think I have a dick, and I in my mind I don't want one. And if you're messing with the lesbian girls, and what I know to be true about women, if you are continually penetrating them with your plastic dick, you cannot get mad at them if they go get some real dick, because if they're in a lesbian situation, you want to have more lesbian women to women interaction with them. And when you start doing heterosexual activities with them and they really start to like it, and then they go get some real heterosexual activity, you can't be mad at nobody but yourself. Like dead ass. Like that's how most girls be losing they bitch to dudes because they think that they, what I'm saying, dicking these hoes down. Like honestly, like you can't feel it. It's a psychological thing. So like in your mind, like, yeah, I'm in this pussy. Like you don't feel the warmth. It's not gripping your skin. Like you can hear that shit swishing, but can you really feel it? So like I'm just like, you know what? And I'm not finna go get me no double ended dildo and fuck the bitch with a dildo inside me so I can feel some penetration too, because like I don't feel like being penetrated. That's why I'm being a lesbian. I wanna, bump on pussies and eat some pussy and do shit that lesbians do. Like I'm not trying to act like a nigga. You know what I'm saying? Like so I totally feel like it's the way that we've been conditioned. And I met a straight girl from California, and like we're like best friends now. And when I first met her, she used to always talk about the way I dress. Like she was like, "You look like a fucking clown." She was like, "I love you. You got the dopest personality, but I don't like the way you dress." She was like, "You don't have to be going around with two big ass clothes on trying to look like a nigga if you want to be a stud. Like, bitch, get some clothes that fit." And then I'm like, "Well, if you don't like my clothes, how about I give you money and you buy my clothes for me, right?" And I that's the best decision that I've ever made in my life, was finding a woman, and her job is in fashion, and she's a buyer for a major shoe corporation that sells clothes, shoes. They have brick and mortar stores online, and the best thing I could have ever done was give this woman some money and tell me like, okay, well, you buy me what you want to see me in, right? And then when I put on the clothes, I'm like, oh shit, like I'm really only like 5'5", 135 pounds. I need a size small in t-shirt. I look like a fucking idiot wearing a size large and the double XLs, and like my waist size is really only a 30. Why am I walking around like a nigga putting on some size 36 pants? Like I looked ridiculous, and it was a woman who gained me up and came at me and was like, yeah, you could be a stud, you could be a lesbian, but you don't have to look like a fucking idiot in the process. Like she was like, I love you, you my friend, and I don't want you going out like none of these dusties. So
Yeah.
Heather, I fuck with you. I appreciate you. Like Heather changed my life because she helped me change the way that I look at myself. Because
Hmm.
I was looking at myself like, oh, since I'm a lesbian, I need to look a certain way. I need to act a certain way. I need to do these type of things. And then I realized, like, bro, I am not no nigga. Like, and seeing these older lesbians in the game, they kind of made me feel like I needed to behave a certain way to be accepted into the community. And I feel like they're doing that again now, but they're doing it because the transgender people aren't as accepted, right? So it's more like an inclusion thing. Like, hey, that's them. Like, shout out to those people who had enough, courage to take that step and live, and and live a whole new life. But that's not me. That's not the life that I'm living, and I don't think that you know the doctors should try to perpetuate that lifestyle on other people that may be suffering other afflictions. Like, and when it comes to diagnosing people, like we have to give them the right diagnoses, because you know when you go to these doctors and you let them convince you that, like, oh, you're trans because you don't feel comfortable with your breast, and then you start taking these pills and you get on these hormones, and then you have a psychotic mental episodes, and then you break down, and then 5 years later you wake up and you be like, I don't want this fucking beard, I never wanted to be a fucking man. And then now you're into self-hate, and there's certain things about your body that change that you just can't switch back. So now
Yeah.
you're forced to continue to live that lifestyle. Or when you, what they call detransition, it's like they hate the detransitioners. Like once you decide that you don't want to be trans no more, it's like they like throw you away and kick you out of the community, and they say they treat you like a piece of shit. Like I've watched so many videos and I'm like, damn, like you can't change your mind no more. It's like the way
Yeah.
they treat the
Probably
bisexual women.
making their decision. In some cases, it might have not have been their decision in the first place. Like you said, doctors are giving you this diagnosis, and you kind of have to go with it. So yeah, why are you going to get mad if someone decides I'm not doing this no more?
Yeah, I think, like, when you talked about your background going to college for gender studies, do you think like your educational background played a part in you being able to be like put your foot down and tell them like no? Like, how hard was it for you to tell these doctors no when they told you that you were trans and you needed hormones? Like, how was the telling them the no? How did that work?
Yeah, super easy for me. Like it ain't no question. Like I'm not doing this. I'll find another person. I'll keep calling. I'll keep asking questions. But this ain't it. And definitely the college background and the educational side of it for sure. Like I even told myself at like a younger age, I'm like maybe I am trans. Maybe I should come out as trans because it's easier to explain to people. But thank God for the education because I yeah, that wouldn't have been the right decision for me. And yeah.
Honestly, I think like a lot of women could benefit from our conversation today. So I'm glad that you took the time out of your day to come on and have this conversation with us, because I know myself as a woman that suffered with not wanting breasts at some point in my life. There's a lot of women who go through this, and being able to hear another woman say like, hey, it's okay to tell these doctors no when you go to these doctors and they try to prescribe you medication for something that you're not identifying at. Like, I think
Mhm.
that it's a strong point being able to have a strong woman like yourself and a strong woman of color being able to go into a doctor's office and say no, this is not
Mhm.
what it is, this is what I want. And being able to be firm with it and find a provider that actually cares about your quality of life and your health, instead of trying to see how they can get x amount of dollars out of Felisha per month because now she has to take medication.
Mhm. Yeah.
So like I love that about you. Like, and I appreciate your courage, and I'm supporting you. I'm like your biggest cheerleader in this whole process, and I'm glad that you found somebody that's actually going to be able to help you so you can feel comfortable and confident and continue to be the woman that you are. And knowing that not liking a part of your body don't make you no less than a woman.
Yeah.
Because there's girls out here who having BBLs every fucking day, going to foreign countries, dying, coming back missing kidneys and shit, because
Hmm.
they didn't like their body that bad, and they didn't have the right people to talk to. They didn't make the right phone calls to try to see if they can get these type of things taken care of by their insurances, because most people don't know certain type of body surgeries your insurance will take care of if you have the right diagnosis.
Hmm.
So it's all in wording. So I appreciate you for educating people and for just being a dope ass person. And for all of the artists that watch this show, because you definitely get the money shot. How can they find you? How can they book you? How can they hire you for some photography needs?
Yeah, I'm located in California, Riverside, California to be exact. But I work in the LA area a lot as well. You can find my IG in that little box in there, but it's Felisha Carrasco 55. If you want to book me, just message me, hit me up. My schedule's pretty crazy, but I always try to make accommodations. So yeah, I do everything, not just concerts, not just sports, engagements, kids, pets, families, studio, cars, lifestyle, anything that's photo wise. I don't do video, but photo wise, I got you.
And if you needed to get flued out, do you go out of town if they leave their deposit and they pay their booking fees up front? Do you travel?
Yes, I do. Yep, yep, yep.
So make sure you have your money back. Felicia does travel. And if you haven't had the opportunity to already, go ahead and check out her Instagram. Check out those pics she got from Rolling Loud. She got the money shot. She got Wheezy F motherfucking baby on there too. Some of my favorite photos that I've seen her do so far today, and I will be biased, is Tinashe. Like the Tinashe photos from the 333 tour, like those were fucking classic. So go ahead and
That's my
check out her.
that's my goal to like shoot Tinashe, like be one of her on tour photographers. Like if I can go on tour with her,
Hey,
if
I
you're
believe
watching
it.
this, if you're watching this Tinashe, I'm shooting my shot. I would love the opportunity to capture you on tour.
Man, look, manifestation is real. I believe in manifestation and the law of attraction, and 6 degrees of separation is real. And a smart person once told me we are all one conversation away from our destiny and $1 million. So I
Yeah,
believe like
if you don't ask,
manifestation is real. And if it's like God got you, you just gotta put in the work, and you've definitely been putting in the work. So I could see you on tour getting some Tinashe shots, but make sure you send them to me so I could post them on my Instagram too.
say less, say less.
But thank you so much for coming out once again. This is Diamond Studded and Pop Politics and Culture, and we have Felicia, the celebrity photographer, in the building. Have a great rest of your Saturday, and we're out. Let's see. Knock